start with just really a core question related to your engagement and advocacy. Your voice, your company's voice has been in our press releases, opinion pieces, and research. And we see this engagement happening because you've been so willing to help and be involved. But you also offer a very unique perspective that's on the front lines of healthcare. And so it's really important for policymakers to hear that frontline view. Can you just sort of share briefly with other allies why you chose to be an ally and what you value in this partnership that has helped and what it's meant to your organization?
Sure, Mary Beth. The bottom line is that fee-for-service, it's expensive, uncoordinated, and it's ineffective. And Medicare Advantage, of which BMA champions so well, is the best vehicle to work differently and to work actually, as opposed to being uncoordinated, to work in a coordinated way, as opposed to being reactive, to being preventative, and as opposed to being fee-for-service, to direct our care model in a value-based way that works for patients and doctors. And so, essentially, ChenMed and BMA's missions are aligned. I mean, we strive to build healthy futures. We both see millions of seniors not getting the care and support they deserve. And we both see how coordinated care through sort of this payer-provider, value-based care arrangements can achieve better results for everyone. And so, we really appreciated how BMA's advocacy just strengthens Medicare Advantage, so more companies like us can innovate and serve the underserved in this country. Believe it or not, it's well, you believe it obviously, but your efforts really they are actually changing lives at the front line. It's allowing ChenMed to grow and transform healthcare at an increasing rate, and we really do appreciate that.
Thank you, Dr. Chen. Drill down into more specifics. You and your leaders have testified before Congress, and that's not an opportunity that many want to run to because there's always those challenges, and we appreciate it. But you've done some efforts like that. You've built up a government affairs team, and you've been taking the message you're speaking right now on the importance of MA to policymakers and their staff. And again, when I talk about you being on the front lines, you're also able to share your experience as a board certified cardiologist and seeing patients still in the Miami Gardens area. Can you highlight what the response is from Capitol Hill when you are doing that kind of advocacy?
This has been a learning process for us. We are used to taking care of patients. But if we just zoom out for a second, the platform is simple. Healthcare in America is just not working. It's full of, well-intentioned, beautiful people that are really stuck in a broken system. And it frustrates me that healthcare costs so much, literally in dollars, but also in quality of life, dignity, and equity. If you don't mind, I'd like to sort of bring in a personal experience.
Please.
And when COVID first started in 2020, in June, I found myself in the intensive care unit, despite being a very well-trained triathlete. And I got to experience COVID from the other side, or at least being really sick on the other side. And it just continued to propel me to act even more. Mm-hmm. I saw how uncoordinated care was, but even more importantly, you get to see how expensive care is. You get to see how patients are frustrated, doctors are frustrated. And then this was actually sort of magnified during these last couple of years, that the disparities between different groups is widening, right? Certain populations get worse care, have worse outcomes, have lower life expectancies, and that is widening. But at ChenMed, we've been spending years looking at this and treating patients and growing to all these different markets. We're in 25 cities today, and we're going to continue to grow at a pretty aggressive rate, close to 40% per year. Despite that fast growth, we are learning better each day how to get better results and do it at a lower cost by moving upstream and trying to prevent people from experiencing what actually I experienced, right? Being in the hospital or in the intensive care unit. And the only way to do that is by treating the entire patient. You can't just focus on pills, procedures, and referrals. You have to think about the entire patient, which involves social determinants that impact health and lifestyles and behaviors. And so these are some of the lessons that we've learned on the front line, and we got to figure out a way to get them into policy. They sound intuitive, they make sense, but we've got to make it easier for doctors to do the right thing to deliver better healthcare at lower costs, both in the exam room, but for the total health, which goes far beyond what we learned in medical school. So right now, the existing fee-for-service system does not allow you to move upstream to actually think about the entire patient and to get rewarded for a positive health result. And we believe that, you know, what you all are doing is really important in helping that frontline experience of moving upstream get into policy so we can have more people providing this kind of care.
Mm-hmm. Dr. Chen, do you have any examples to share with other allies on where you felt over time you've been able to make progress in conversations with policymakers to, you know, see the value of MA and to see the value of, you know, your model in serving patients? Because I know a lot of times when the advocacy starts, you sort of feel you're falling on deaf ears, and it's part of the process and it takes time. So didn't know if you have any examples to share where you feel, you know, how you were able to move the needle.
You know, even before you show data, just getting the emotional buy-in that there's a broken patient experience and there's broken outcomes is really important. You know, we've all suffered, or even watched family members suffer or friends suffer in a highly uncoordinated, broken fee-for-service system. And once you live through that, like I did personally, my family did when my dad was diagnosed with initially with a terminal brain tumor and given 2 months to live, it propels you, and of course it creates this drive and urgency and sometimes anger to change the system, right? It's really hard for a large incumbent system to want to change, especially something as large as healthcare. And then immediately you move from sort of this personal sort of moral imperative that you have in terms of what you see, and then you go move to anecdotes, and there's a lot of stories. But I then like to just follow up with good old-fashioned data. And so at ChenMed, you know, we've published that we can reduce hospitalization rates by 30 to 50% in the most underserved and overlooked senior populations, right? We have, you know, the majority of our patients, over 50% of them are African Americans, close to 70 to 80% are underrepresented minorities. We have 40 to 50% of our population are dual eligibles. So this is a really vulnerable population. And for that population, in addition to reducing hospitalization rates by 30 to 50%, we can, you know, decrease stroke rates by, you know, 20 to 30%. We've published. We can increase or improve cancer survival rates at 6 months by over 50%. Right? We substantially reduce heart failure admissions, and we do this with just good old-fashioned primary care that is absolutely incentivized to actually move upstream, take a look at the whole patient, and drive down sort of preventable catastrophic events. You know, the BMA has been a great ally because the only place where you can do this type of innovation is in MA in a two-sided risk environment. And so really appreciate the sort of work that you guys are doing to drive that attention to, you know, I mean, think about those stats, right, that we just mentioned. Mm-hmm. And that on top of net promoter scores that are in the 80s, right? So net promoter scores in the 80s in healthcare is pretty unusual. And we are able to systematically drive great patient experience, superior patient outcomes, and do it at a lower cost.
Well, thank you, Dr. Chen.